Hi, my name is Caitlin, and I'm here with the Telford School of Management to talk to you about the Canadian Blood Services. Canadian Blood Services is a non-for-profit organization that was founded in 1997 when the House of Commons tabled the Royal Commission of Inquiry on Blood Systems in Canada. They get funding from all levels of government and also accept public donations. The Canadian Blood Services operates in every province and territory in Canada, giving much-needed services to hospitals. The Canadian Blood Services works off of 6 main principles: that blood should be a free resource, blood is a public resource, a system of blood collection should be implemented in Canada, donors should not be paid to give blood, safety of the blood supply is paramount, and we should not have to import any blood from other countries.
After learning about this great organization, you might be wondering what you can do to help. The Canadian Blood Services have 35 permanent donor centers and over 4,000 mobile donor centers across Canada, meaning there should be one close to you. There's even multiple here in Ottawa, including one on Carling Avenue. However, before heading into a location near you, it's important to take the eligibility quiz on their website, blood.ca. This is a short quiz that takes less than 10 minutes, which asks you questions such as: are you 17 years or older? Have you had a tattoo or piercing in the last 3 months? Have you traveled outside of Canada, the continental USA, Antarctica, or Europe in the last 3 weeks? From January 1st, 1980 through December 31st, 1996, have you spent a total of 3 months or more in the United Kingdom, England, Northern Ireland, Scotland, Wales, the Isles of Man, or the Channel Islands? Have you spent a total of 5 years or more in France and or Ireland, the Republic of Ireland, from January 1st, 1980 through December 31st, 2001? Have you been to the dentist for an extraction surgery or root canal in the last 3 days? Are you pregnant, have been pregnant, or had a baby in the last 6 months? Are you taking prescription medications? Do you weigh more than 50 kilograms or 110 pounds? After you are completed the quiz, you'll be given a prompt to book an appointment at a local clinic. However, just so you know, final eligibility is determined by staff at the blood donor clinic. So if you have any questions, use our live chat, email feedback@blood.ca, or call us at 1-800-2-DONATE.
The Canadian Blood Services works in 4 main sectors: blood, plasma, stem cells, and organs and tissues. They collect blood through blood drives and through donation centers, as well as test for blood types and can test for different types of blood diseases, such as syphilis, hepatitis B, hepatitis C, HIV, and the West Nile virus. Finally, they also manufacture through contracts different blood products, such as red blood cells and platelets. With plasma, the Canadian Blood Services collects plasma from volunteer donors throughout the country. They keep some of those plasma products for transfusions, while sending most of it to manufacturers to create plasma protein products. These plasma proteins are then shipped to hospitals all around Canada to help patients with immune disorders such as hemophilia. In stem cells, the Canadian Blood Services collects stem cells through the same system as the blood bank, as well as manufacture stem cells through the same connections. They also keep and maintain a national registry of potential adult donors to find the best matches for recipients, as well as keep a registry of human lymphocyte antigen, or HLA, to match donors with the best possible recipients of their stem cells. The Canadian Blood Services also does a lot of research into furthering all of these topics and helps participate in others' research. As well as with the public, they help to raise awareness about transfusion and about transplantation with both stakeholders, medical professionals, and the general public.
Additionally, safety is paramount in everything the Canadian Blood Services does because lives depend on it. Canada's blood and blood product supply is recognized as one of the safest in the world, and the health and safety of the donors who contribute to that vital resource are equally important to them. Prior to or during your appointment to donate blood, plasma, or platelets, you'll be asked to read a pamphlet with important health and safety information. During your appointment, you'll be asked to confirm you have read and understood it. You'll be able to ask any questions if you are not comfortable with any of the information provided, and if you have any questions that aren't answered online, you can contact the Canadian Blood Services at 1-888-2-DONATE. The Canadian Blood Service has been attempting to safely increase their donor pool in several different ways, in which one of them has been allowing members of the GBMSM community to donate both plasma and blood. After a rise in HIV and hepatitis cases in the 1970s and 80s, a lifetime ban was put on men who had sex with men, preventing them from donating blood. However, a change in the rules then enabled these men to donate blood, and the blanket ban was then changed to a 12-month deferral period, then to 3 months in 2019, and in 2021 these men were even able to donate plasma at the Calgary and London locations. An example of the effects of this legislation can be seen with Miguel. Miguel was one of the first plasma donors in the new program that expanded eligibility for gay, bisexual, and other men who have sex with men. When Miguel donated plasma during the last week of September in 2019, it marked an important milestone for both him and for Canadians Blood Services. Miguel was an active blood donor until 2014. However, when he came out as gay, he was denied the opportunity to donate blood and plasma, but now is again eligible to save lives once again. Since 2019, men have been eligible to give blood or plasma if it has been 3 or more months since they have had sexual contact with a man. In late September, however, donor centers in Calgary, Alberta, and London, Ontario began to apply new eligibility criteria that enable some sexually active gay, bisexual, or other men who have sex with men to donate plasma, the protein-rich liquid in blood that can be used to treat a variety of rare and life-threatening conditions. Ultimately, the Canadian Blood Service's goal is to remove the current waiting period for men who have sex with men and use a sexual behavior-based screening for all donors. Now that we are properly informed about this wonderful organization, it's time to tell you guys what we have been doing to contribute to the Canadian Blood Services. So far, we have raised awareness concerning the impact of donating blood by describing its importance to the Student Council, along with possible actions to promote its significance in the school community. Additionally, we have posted information about how to donate on social media and have also discussed its importance with people outside of the university, including friends and family. In addition, we will continue to strategize and attempt to bring representatives from the Canadian Blood Services to talk to students at school to further spread awareness regarding this organization. In conclusion, throughout this video, we have discussed what the mission of the Canadian Blood Service is, what they do, some challenges they have had to work through, and the implementations they have done to correct these problems, and the steps we have taken to enhance the impact of the Canadian Blood Service in our community.